People often ask, can ACT be used to treat OCD? And the short answer is yes. ACT is best used alongside ERP and is a fantastic treatment for OCD. But before we get into that, let me introduce myself. My name is Rachel Steen, and I'm a licensed therapist here at NOCD. I specialize in treating obsessive compulsive disorder. And I'm here today to talk to you about ACT, which is an acronym for Acceptance and Commitment Therapy, and how you can use ACT alongside ERP, which stands for Exposure and Response Prevention, to treat OCD. So what is ACT? What is Acceptance and Commitment Therapy? ACT is a contextual behavioral therapy that focuses on teaching people to live a life where they have a different relationship with the internal experiences. We talk about internal experiences, the things that happen in your head. So your thoughts, emotions, urges. ACT is trying to help you recontextualize those experiences, not as something that you need to push away and run away from, but as something that you can willingly accept. And doing that allows you to focus on building a valuable, meaningful life alongside the painful things, rather than putting off a valuable, meaningful life until you can have no pain or no discomfort. So ACT therapists teach their clients skills to engage differently with their minds in order to live a better, more fulfilling life. Now, it's important to note that ERP is the frontline primary treatment for OCD. It is the gold standard based on all the abundant research there is on how effective exposure and response prevention is for treating OCD. Having said that, ACT is also an evidence-based treatment for OCD. And so we found really effective results from using ERP and ACT in conjunction to really holistically treat someone with OCD. ACT and ERP are both behavioral therapies, so they mesh together very well. ERP provides a really wonderful structure and pace to treatment. And what I often do is kind of interweave some ACT exercises and theories and ideas into the process of an ERP treatment. So in some ways, the treatments might look very similar because ERP is still the focal point and the main thrust of treatment, but ACT adds some really helpful tools and systems and ways of thinking about OCD that can really help people get well and stay well. So let's talk about what this looks like. How are we using ACT as like a supplement to ERP? While ERP is the supporting theory and the through line, how are we inserting ACT into a treatment for OCD? So one of the really special and useful things about ACT is ACT likes to help people to think a little bit differently about their own mind and relate to their mind differently. So one way that ACT does this is by asking people to relate to their mind using metaphor. Because I think something that's tricky about being a human being is that we can only think about our own mind with our mind. So it's easy to get tangled up in understanding yourself and get stuck in that way. So ACT uses metaphor to help people conceptualize what's happening internally in a way that's helpful and gives ideas for behavior change. How can you make your life better because of this new understanding and relationship with your mind? So the basis of exposure and response prevention is that instead of doing what OCD suggests, which is avoiding and controlling our internal experiences, so trying to not think about those intrusive thoughts, trying to avoid the way that they make you feel, exposure and response prevention is saying we're going to purposefully confront those fears. We're going to encounter them on purpose. So the classic example is if you have a fear of germs, you might approach something that feels contaminated on purpose in a very structured, paced way as part of an exposure and response prevention treatment. So when you're adding ACT into that treatment, you would do exactly the same thing. You would use that gold standard ERP structure, but then ACT might help in the initial portion of having a conversation about why and how to do this very tricky thing of exposure. Because as you can imagine, it's a little bit hard to do ERP. It's scary to take that initial step when you're not sure if it's going to help yet. You're not sure if you're going to feel better. So often early on in therapy, I'm having this conversation with my clients about their fears and their worries about doing it. And there's a little bit of a uncertainty about, can you really do exposure? Can I get myself to engage in this process? So I like to use an ACT metaphor to help people engage with why ERP is going to make their life better, and also why what they're currently doing of using compulsions is not going to help, is not going to ever be the solution to their problem. So the metaphor that I'm referring to is an ACT metaphor called the tug of war. So in this metaphor, I ask the client to imagine their OCD as kind of a personified monster. So you can imagine like a ball of strings, or you can imagine an actual monster, however you want to view it, it's your OCD. And so the thing that I say is that the relationship you have with OCD is as if the monster is standing on one side of a cliff face and you are standing on the other. And between the two of you is a rope. And all day long, OCD is saying to you all these intrusive thoughts. So example, OCD might say, you're not clean enough. You're not good enough. What if you did this and you forgot? What if you didn't do this and you forgot, right? There's all different things that OCD says. And so every time it does that, it's like you're feeling a pull on the rope. It's like it's tugging you towards the edge of that cliff face. And like any normal person, when you feel tugged towards the edge, you get scared, you get panicked, and you pull back on your end of the rope. And you say, I am clean enough. I am good enough. I didn't do anything wrong. Oh, and then that turns into compulsions, right? You wash your hands again. You check again. You ask for reassurance. All of these things that people with OCD commonly do. And so what that produces is a back and forth, a tug of war between you and OCD that is never ending, right? Because no one really wins. You just stay stuck in this back and forth. And it's, as well as never ending, it's exhausting, right? Like if you have OCD, you know exactly what I'm talking about, where it just feels like you're so tired of this battle. You're so tired of this back and forth, this push and pull with OCD, and you're stuck. You're really, really stuck in this situation. So hopefully you can see from this metaphor how ACT is helping to enter into something that's happening in your own mind, right? The monster and you, the tug of war, it's all in your mind. But now that we have this metaphor, it helps you to kind of think about it and engage with it and feel it, and also in a visceral way, like, yeah, this is really stuck. This is really not working. And so as your ERP therapist, then I would say, I have a suggestion to change this relationship between you and OCD. My suggestion is that you let go of the rope. And so when you let go of your end of the rope, OCD can kind of chatter and chatter, but you're not playing the game. You're not engaged in OCD's way of solving the problem, where you do compulsions whenever it tells you something intrusive. And so what dropping the rope means is doing exposure and response prevention. It means taking these steps to gradually confront your fears and be willing to listen to what OCD has to say without changing your behavior to try and fix that internal experience. So there's a lot more to it, right? ERP is an involved process. There's a lot more to ACT as well. But this is just one example of how an ACT metaphor can help in the ERP process and can help to set up the rest of the work that you're going to do. I hope that you left today with a feeling of hope that OCD is manageable, OCD is treatable, and you've come to the right place if you want to learn more about that. And so if you or a loved one is suffering from OCD, please reach out for help. You can at any time schedule a free 15-minute phone call at NOCD, and we can tell you more about our treatment here. If you just want more information, you can always go to the NOCD YouTube channel to learn more, primarily from our clinical director, Dr. McGrath, who also hosts a podcast about OCD. Those are great places to go and learn more. Thank you for being here today.